Okay, so let's hope I can get my presentation to play while I'm sharing my screen. I think that I can. Here we go. All right. For those of you who don't know me as well as others, sorry for those of you who do, this might be a little like too much background, but I used to do a lot of work with the ECCs, so it's really fun to be back working with you guys on this project. And I also used to do work with the Department of Public Health and Human Services as their CPS administrator and as an assistant attorney general doing all the child abuse and neglect cases across Montana. And it was early on that I went to the Intermountain ACEs presentation. And so I feel like this has been a topic that's been near and dear to my heart and to Montana for a while. And I would also say that at any point in this presentation, I really want it to be more interactive. I know a lot of you have history with the ACEs work that's been done in Montana in the past. And then I also know Bree, who is on our call, is actually a master trainer. And I don't know if anyone else on this call is. So I'm not like presenting to you as like the expert on ACEs, but I do like love this topic and have really liked it for a long time. And I'm excited to talk about like what's next and where do we take the work that's been going on and how does that look in each community. So I'll start by talking about things, like I said, pop in the chat. Maybe Steph can stop me or Bree can stop me if there's something going on in the chat and I'm just chattering away, that you won't hurt my feelings. Because I'd really like you to add anything I've forgotten and give input into what this work should look like in your communities. Hopefully you're all familiar with the agreement that maybe Steph has been sending around. And so this does relate to that. So I thought we'd start with like a little bit of background on ACEs. I'm not assuming that everyone even knows what we're talking about. Maybe you do. So I'll try to be brief, but I wanted to not assume anything in terms of the underlying information to where we go from ACEs. Then we'll talk about PCEs, positive childhood experiences, ACEs being adverse childhood experiences, and HOPE, health outcomes from positive experiences, and we'll elaborate on both of those. And then the future vision and action planning, that is really part of the work that we hope to do with you and others and across the state to carry this work forward. Okay. So first, ACEs, looking backwards. I'm guessing that most of you have heard of the adverse childhood experiences. Whether or not that you've heard of the actual study, that's the next slide. But basically, ACEs are just traumatic, potentially traumatic events that happen to children in 0 to 17. I'm not going to read these slides to you at all. We definitely will send them out with all sorts of like stuff you can use in community conversations. So don't feel like you have to like try to take notes or remember what any of them said. Obviously, adverse childhood experiences can undermine kids' safety, stability, attachment, bonding, and results in substance use problems, mental health problems, kids in houses, parents in prison or jail, those sorts of things. And then linking those adverse childhood experiences to chronic health issues, mental health, substance use disorders in adolescence and adulthood, and how do those impact our communities? So this is all sort of the ACE work that went on, when would you say, like maybe the early 2000s, around 2010. The study itself was from a study out of Kaiser Permanente. I believe it was 1998. It's also published, whatever this slide says, 70 research papers since then. And at the bottom of this slide, there's this great website. And so I'm going to sort of try not to be too ADD on you and click all over the place during this presentation, but there are websites that when we send this out that you should look at if you're interested in where does this come from. I didn't try to be like a perfect citation person, but this is all on this website. That's the PACES connection, and that stands for Positive and Adverse Childhood Experiences Connection. So there have been 70 papers on this one particular study. They looked at 10 ACEs in that study, so it was small. We know there's more than 10. It's bigger than that study, obviously. All they looked at were these 10 that are listed on this slide, and then it's gotten broader. People have looked at not only the adverse childhood experiences, but community experiences, climate experiences. There's more out there on all of this. But I feel like Montana has done a lot of work in terms of educating folks on ACEs. If you've really never seen it and or you think you have coalition members who are very unfamiliar with it, I found this really like super short 3-minute video. So I'm just gonna let you watch. Can you hear it? Do you have volume? Okay.
Rob and Vince then began a collaboration that's ultimately become one of the foremost epidemiologic studies of long-term health impacts of child abuse and neglect.
I think the most important thing that contributes to the information of the ACE study is simply the powerful nature of when people tell you the truth about their lives and you listen, you understand their life course.
It's made me realize how much of what we see in adult medicine is the result of what was present but not seen in pediatrics.
ACE has changed the landscape, and I want to talk a little bit about how and why they changed the landscape and how we can take what we've learned from the ACEs.
It's just not a social worker's problem. It's just not a psychologist's problem. It's not a pediatrician's problem. It's not a juvenile court judge's problem. It's everybody's.
It changed the landscape because of the pervasiveness of the ACEs, the huge number of public health problems, expensive public health problems, depression, substance abuse, sexually transmitted diseases, cancer, heart disease, chronic lung disease, diabetes.
As the ACE score goes up, the likelihood of chronic self-acknowledged chronic depression goes up, so that an ACE score 4 or higher, you're bumping a prevalence of 60%, 60% in women and about 35% in men.
This is the percentage of people that ever smoked cigarettes, and here's the percentage of current smokers. Again, we could switch the titles on these slides now. You wouldn't know which was from the Kaiser Health Plan and which was a general population sample of Washington.
So how do those people without the conventional risk factors end up with coronary disease? We have used this over an 8-year period with 440,000 adult patients.
I believe that this is the most important thing you can ever do, which is begin to deal with this intergenerational transmission of adversity that causes so many problems in our society.
All right. So sorry if that was like, just too basic for some of you, but I really do think the ACE study was sort of a groundbreaking shift in some of how people thought about childhood and its long-term health impacts. Bree, do you want to say anything else at this moment? I mean, I know.
No, I think you really captured it. I mean, just some of the history is, in 2012, 2013, there started to be a lot of activity in Montana around measuring ACEs and talking about ACEs and studying ACEs and training.
Yeah,
and
I'll definitely get to that.
Yeah, you're going to get there. But I just think, but at this point, I think most of us understand that, brain development happens early in life, and that goes in a supported way, the outcomes are better. But the whole point of this is what you're going to get to is like, okay, so now what?
Right. So yeah, these were just some of the highlights of the study itself. Obviously, we found out that they're very common, that they can have negative long-lasting impacts on health. And so I'm not gonna go into all of those. I put the website with like all sorts of research, more than you could ever imagine or want to see up here. And really, I would say the other pieces of what I recall and what stood out to me was just how ACEs brought to light toxic stress during childhood and what that meant for brain development and your nervous system development, endocrine system development, immune system development. I know now there's looking at the connection between ACEs and gut biome health and that sort of connection. And all of that, I think, was just very interesting and very much brought to light by that ACE study, and trying to make like the connection between why are there these long-term health outcomes from these experiences, and really connecting it to that toxic stress, high levels of cortisol, and those sorts of things in children's brains and bodies. So there's really great little videos about this as well, but that's not this training today. But if you guys want to go into that and you're looking for resources when you do have, conversations with your community, if you feel like there's people who we need to, go back and sort of educate more about like toxic stress, there's some amazing stuff out there. So anyhow, this was what Bree was starting to allude to. Montana did collect ACEs data as part of its behavioral risk factor surveillance survey, the BRFIS, in 2011 and 2020. I'm just gonna pause for 1 minute, because does anyone know where exactly that data lives? You might wanna, if you do, like even have a website, you would type into the chat. Steph and I have looked for it, and I can find people who've worked with the data and data that's out there, but the actual like underlying data isn't. They say on the CDC website that it's kept by state BRFISs. So it's just, I just wanted to throw it out there. Montana also has trained master trainers. So initially when they came to Montana and began presenting information on the ACE study, it was Dr. Rob Anda and then Laura Porter with ACE interface. Now you've seen that on the past slides, PACE interface. And so they, through the Department of Public Health and Human Services, trained how many master trainers in the state? Do you remember, Bree? 15, maybe 20, I don't know. And those were
Something like that.
who went through a training with their program, and then were able to go offer trainings in the community. And then there was a Elevate Montana that began, and anyone who is a member or still participates, there are on the map groups, and I believe Helena's is fairly active, and there were several other listed. So those began in the early, around 2000, probably 13, 14. There's a timeline coming up. And then there's also the Montana DPHHS SHIP, or State Health Improvement Program. Sorry, my computer likes to move itself sometimes. And they have a goal on their SHIP that focuses on prevention of ACEs. And so some of this work that we're doing with all of you relates to the work of that plan, and trying to create an action plan that aligns with the work of that group as well. And we also know that local groups and coalitions such as yours have carried on this work in different communities, and would love to know what's out there that's been going on, and in particular if there's work related to some of the things we're going to talk about coming up. So this is just some of our old Montana ACEs data that I could find out there from random different fact sheets. We're happy to send out these fact sheets that we found. But like I said, if there's other ACEs data that you guys are aware of that's out there, type their websites into the chat, or we will follow up with the BRFIS survey folks and see if we can hunt it down. It might only be in a format that researchers can then manipulate and look at. I don't know, epidemiologists, but you can see the little pictures are over my slide, so I can't really see this data real well. But as I recall, Montana children's ACE data was, concerning, and showed that prevention of ACEs was definitely a focus that needed attention. Anything else that anyone has to say about like ACE work, ACE data from Montana? I know that the SHIP group also maintains this great website, ACEs and Resilience Resources. And that's through the, like I said, the State Health Improvement Plan, short is SHIP. And they have a great timeline as well on their website that really shows you where the state has been in terms of its work on this topic.
Yes, sir. That's just the one thing that I would say to add is several DPHH directors ago, Richard Opper, he made a priority that every single person that works for DPHHS will receive a training on ACEs. So, you know, thousands and thousands of state employees were trained on ACEs. And that was really, really a cool thing that he did that really propelled this. So we were all kind of speaking the same language. But as things happen and directors change and priorities change, it all kind of just slowed down. But I think several of the people that were trained still are there. And there's just a, you know, there was kind of like a, it was just kind of a pause, I would say. There's a lot of investment early on. And there was a man named Todd Garrison that was really the champion of this work. And like many of these causes, it really needs a leader. And Todd really just stepped up and raised money and got people together and got people trained. And, you know, when Todd walked away from that work, the work also kind of slowed down. So again, it was kind of resource and funding dependent, never that it wasn't important to folks. But for a few years now, we've been kind of simmering, I would say, on the subject. And the Elevate affiliate, the Elevate Montana was a movement. It was trying to bring people together outside of their organizations to elevate the awareness and elevate kind of, you know, the engagement around like understanding the importance of supporting kids in early childhood. And yeah, there's some affiliates across the state. And I know that Rebecca Hargis is going strong in Helena. And again, the State Health Improvement Plan has written ACEs into the plan. And so there is a really active group that meets monthly. That's an open group. And I'll put the person's name in the chat that runs that in case you guys want to join in.
Thanks, Bree. Yeah, there's definitely been a lot of historic investment of resources and effort around ACEs. And I think that there was a lot of excitement and like you said, the work slowed down, but I think there was also a lot of like, what's next? And so I think that is sort of what has been simmering for the last couple of years that you refer to and sort of that my slide refers to. I'm just going to pause before we talk about what comes next and say, does anyone want to add anything, share anything, correct us? I don't know, like. Okay, all right, carrying on then. So the what comes next. So I don't know that you know, maybe not everyone had this experience, but I do remember a lot of people like asking like, so what? Like, this is really heavy information. I don't really know like what to do with it or how this is helpful. And so I think, you know, there's always been conversations about resilience and there's always been like safe, stable, nurturing relationships and environments. But I don't know that until more recently, some of those things became more formally connected as you know, a response to ACEs and or a counterpart, maybe. I don't know what PCEs exactly how you would frame them, but positive childhood experiences. And so this is the science that has been emerging more recently. I would say in the last 4 years, if you go to this website, once again, like it'll start with all the ACEs research and then it'll start into the positive PCEs research. So it really has become like one seamless sort of thread in the world of ACEs and PACEs. So it's added a letter from ACEs to PACEs to include the positive and adverse childhood experiences. And so you can see that, I don't know how many of you remember Rob Anda and the initial ACE study presentation, but there was that dose response association that they kept coming back to, that meant this really was a big deal. Like adverse childhood experiences were really connected to these outcomes because you could see the dose response relationship. And so, whoa, lo and behold, there's such a thing between positive childhood experiences as well. And so in 2019, that was sort of the research that came out in the Journal of American Medicine, or Academy of whatever, Pediatrics. I'm not going to get my right words. JAMA in 2019. And then they started talking about the presence of flourishing increases when there's family resilience and connection. And then in 2021, this greater childhood family connection associated once again with those more positive outcomes, regardless of the level of ACEs. And so it was the beginning of sort of looking at these, I don't know, buffering impacts, or how positive childhood experiences really interact with ACEs, and what does that mean? In line with that, and if you go to this website, I don't know, there's a really long list. Like, this is just a small piece of what's out there. I would encourage you, you know, and we can send out a longer list of research if you want to share more. I don't know, you know, what level of detail your local conversations want to talk about some of this new stuff in, but there's really good lists out there. Okay, and then in line with that research, there with positive childhood experiences. So I think some of this language is somewhat tricky, and I'm open to, you know, whatever thoughts you have on it, Bree and/or Steph or anyone else. PCEs and hope, like what is which one? And hope really is health outcomes from positive experiences, and it's from my look into all of this, it really seems connected to the Tufts Medical Center and the work that they're doing, which is connected to the Montana Institute as well. And they've done the data analysis from Montana, and that's the Montana Hope Report. So when you see the hope variables, it's not exactly the same as PCEs, but they're very much, I would say, connected. Bree, how would you frame that for folks?
Yeah, sure. Or Steph to chime in, but yeah, health outcomes from positive experiences is another Burfus kind of set of questions that came out of a CDC think tank years and years ago that was tied to, a lot of us have heard the safe, stable, nurturing relationships and environments, SSNRs. And then there's just a bunch of work that came out of how to build SSNRs in community. And then that group has been working with the CDC over time to think about, like, how do we start to measure resiliency and hope? But at the same time, this positive childhood experiences kind of, I don't know, research is blooming. And again, and then early relational health, the science of thriving. There's just not really good language that's really encompassing it, but it's kind of the same body of work, a body of research that's forming around how do we measure the good stuff. Steph, do you have anything to add?
No, what I would add is that there is going to be some differences once you get down to the nitty gritty as a researcher, but overall, and I would say generally with the community level meetings, the concept is we know that adversity in childhood impacts adult health outcomes. We're learning more about how positive experiences in early childhood affect adult health outcomes. And so it's an advancing thing, but that's the general idea. And I think there are enough people on here who have been through, you know, like Bree said, the safe, stable, nurturing relationships and the, you know, all of the different kind of buzzwords that, you know, come up and you're like, wait a minute, this sounds entirely familiar. I think holding that a little bit lightly and knowing that, you know, as you're talking to folks in your community or on your coalition, acknowledging the similarities that exist there and being very clear about how you make those connections. Because sometimes we can be like, oh gosh, we already did this. And we're like, yeah, we already did, but they needed a fancy new name to publish more things. And maybe it's a better name. but also maybe it's another way to get more interest and continue to reinvest and build this body of research and work.
All right. Thank you both for chiming in, because yeah, it is emerging, and so I think the language is evolving and somewhat can be confusing to folks. So in terms of hope, the building blocks they really look at are relationships, environments, engagement, and then the social and emotional development piece. And their focus is really that these long-term negative adverse childhood experiences can be mitigated by positive childhood experiences, which may have more salient impacts on adult health and well-being than previously thought. So what exactly is that interplay between ACEs and PCEs? And particularly as we go forward, like what does that look on a brain development level, or what different epigenetic impacts are we seeing? All of those different levels of research to come, I guess. So we have some basic beginning research in Montana, so on PCEs and HOPE. Montana, I gotta say, we were one of the first, right, Bree, to collect these HOPE measures in our BRFIS, the second after.
Second, behind Wisconsin.
Okay, yay. And so there have been at least 2 papers that have been published using the data that was collected. There might be more. This is just sort of a follow-up to our other question, like we're not exactly sure where all of it lives on the state website, or if there's a quick way to go look at it all. But these are what they asked about on that 2019 BRFIS. These were the PCEs. There was a slide at the beginning about the ACEs. So who felt safe and protected by an adult in their home, a sense of belonging at high school, supported by friends. At least 2 non-parent adults took genuine interest in them, able to talk about feelings with family, enjoyed participating in community traditions, and felt families stood by them in difficult times. So I think, like Bree said, a lot of these things relate back to that safe, stable, nurturing relationships and environments that kids do better, and it does have that buffering impact. So what they found was that was true. So we will send you out the whole reports, and I'm sure Steph will do that at some point, but I just sort of cut and paste from this HOPE report and there is a live presentation that they did on the report that is on YouTube. So you can go there and watch that if you're interested. We're not trying to repeat that today either. But like the key findings, and I think some of this is probably relative to the scope of work for the ECCs, because it does tie into prevention of substance use disorders and those sorts of things. So this research really did find that positive childhood experiences do have a buffering impact on adult substance use behaviors, specifically cigarette smoking. And now I need to figure out how to collapse my thing so I can see for you guys. All right. And that these positive adult outcomes of PCEs extend beyond lower risks of physical and mental health to include a lower likelihood of cigarette and illicit drug use and lower likelihood of problem drinking behaviors. So let's see if it'll come back. Some of the key findings: that there is a positive community norm in Montana that regarding positive childhood experiences. So I think if you're familiar with the work of the HOPE work, a lot of their work also talks about positive community norms. And certainly, I'm sure some of your ECCs may have focused on those. The more PCEs reported, the lower the prevalence of ever having been a cigarette smoker. The more PCEs reported, the fewer alcoholic beverages consumed in the past 30 days. More PCEs, fewer drinks consumed per occasion. Obviously, we know binge drinking is a big deal, so that relates to that. And those who reported the lowest levels of PCEs reported more incidents of binge drinking in the past month. And fewer total PCEs was the higher the maximum number of drinks consumed in a single occasion. And my dog is very excited because someone just walked in my door. Sorry. And those experiencing the most PCEs reported the lowest prevalence of illicit drug use. So I think this is pretty compelling data. And I'm trying to understand. Can you guys hear me? You disappeared on my screen, so I'll just keep going, but you'll have to stop me.
You look good and your presentation's going and we cannot hear your dog.
Okay, good. So
You're
I'll
good.
just keep right on going. All right. So these were the recommendations from the report. There should be more efforts to promote the existing positive community norms of PCEs in Montana. There should be more funding and promotion of evidence-based programs and services or promising practices, including education about PCEs, such as home visiting, positive parenting classes, because those are critical to seeing these long-term positive health outcomes realized. And I'm sure the list is longer. You guys in your ECCs have lots of these programs, I'm sure, in your communities making a difference. Make equitable adjustments in the process and policies of systems to fund and promote programs and services so that more families obviously have access to such services. The second Montana research that came out was a paper that was about associations between positive childhood experiences in adult smoking and alcohol use. And this one is harder for me to pull out key findings from, but I just wanted to show you the graphs because I think they are similar to like the initial ACE study graphs where you can see that dose response. So if you never or rarely or sometimes had a positive childhood experience, then you were you felt safe and protected by adult in your home. If you didn't feel protected, then you were way more likely to smoke 100 cigarettes. So you can see that all of those factors that they asked about, the gray is significantly larger. So there is that buffering impact on smoking 100 cigarettes. There's also that similar impact. You can see that those gray are so much longer and more risk to be currently a smoker or to have had more drinks in the past 30 days. So we'll send out these articles, but I just think that it's interesting and compelling to see that there's that same significant connection when you start looking at the positive as when we looked at the adverse childhood experiences. And so how can early childhood coalitions and community groups use this new information to just, help build more opportunities for positive childhood experiences, knowing what a difference they make. On a national level, like I said, we've seen a shift, at least like the training that came in and did the master training for Montana from ACEs to PACEs. And this PACEs connection, you've seen me pull up several times. This is the little map that it has, on its website. So you may see your community on there, whether you know it or not. I just copied and pasted it. And it's got a great program that it'll, kickstart your own community. So there's lots of different community groups out there. And they have lots of ideas and information. From the CDC perspective, they haven't really talked from what I've seen and from what I've heard from others about PCEs yet. I know obviously they put the HOPE data in their BRFIS because we collected it. But when talking with the state a little bit more about this funding and funding for the SHIP, the State Health Improvement Plan that talks about ACEs, we were pointed really back to the language about preventing adverse childhood experiences. And so Steph and I had a conversation about how maybe logically it's not exactly the same preventing an ACE as providing a positive childhood experience, but it seems like in the CDC world, it actually is. So I put this little chart up here to help us see that and maybe make that connection, because I think there is some, people who will say preventing ACEs, and we really just wanted to build a bridge to preventing ACEs and PCEs. So when CDC says preventing ACEs, they're also talking about strengthening families by increasing financial security, work-friendly policies, Here we go, public education campaigns, so like positive community norms stuff. I'm not gonna read all of these, but they go into home visiting, childcare, preschool with family engagement, social emotional learning, parenting skills, mentoring programs. So as you can see, they're preventing ACE. This is actually like a positive childhood experience if you find that adult mentor and they become that person in your life that we talked about on that hope questionnaire. So there's a link out there, and I think it can be somewhat confusing, but hopefully this helps to clarify as moving forward in your communities how you would present some of this information as you sort of come up with a plan. It doesn't seem to me that it particularly needs to be anything new, because a lot of it seems very aligned well with the LIFT's work of connecting families to these supports, and then making sure that they have the support from those programs. Okay, so what comes next? We have a little bit of time, and I'm hoping that we can have a discussion if you want, and or even just a time to ask questions of Steph, and or to let us know what you need to move forward. The next steps really involve local ECC meetings to talk about the Hope Report, positive childhood experiences, and to have some local discussions and come up with like what's next. In specific language from the ECC scope of work, what's next? You are all here attending this training about PCEs and learning about our findings in the Montana Hope Report. So now you know that PCEs have that strong dose response association with prevention of substance use and improving all sorts of health outcomes. And then you are going to host and facilitate a discussion with your community to share this information and talk about how to raise awareness and discuss ways to engage additional community to build resiliency, and discuss the LIFTs as one strategy, and then provide a summary of that meeting back to us. So at HMHB, our role is sort of to take the information from you and then to create more of a statewide action plan and figure out how we can come to support the work at a broader level, even though it won't be exactly the same in each community, but to take that information, and if it is, to try to avoid duplication and do those sorts of things as a more coordinated effort. So Steph, do you have more to add about the scope of work?
I'll add in dates. Oh, there you go. I'll add in dates really quick. So we'd like all of the community level meetings to be conducted by July 14th. If you can let us know, when you're going to have those meetings, and also like what you need, if there is some need for HMHB support like on the ground. We'd love to hear about those asks. Can't fill them all, but thinking broadly and shooting for the moon, what do you think would be really helpful in conducting those meetings? And then that last slide, get that summary of the meeting back to us by July 21st, and we'll just do that through that same online submission form. I think the one other thing that I'll add is kind of playing off of that, why are we including that CDC? It's not really talking about PCEs, but they are talking about preventing ACEs. I think it's important to note that this same kind of work, how we're supporting, improving experiences in early childhood, is talked about in a lot of different ways. And we've hit that pretty heavy in this presentation, but folks in your community, such as prevention specialists, or home visitors, or even folks trained, in behavioral health or mental health or in medical fields, these are the partners that you have in your work. And despite the fact we're all maybe talking about the same thing and serving the same families, we use different language for that. And so that's why it's really important to think about, what is the CDC saying about this? And as we very intentionally try to make clear the fact that, investment in early childhood is about prevention of, poor adult and adolescent outcomes. I think we need to continue to make that clear, that prevention really starts in the work that you all do. And while we have some strong places of adolescent substance use prevention, suicide prevention at different points across the state, I think making it abundantly clear that much of that can start right with you all in your communities, in the work that you've been organizing, and in the work that's kind of already being done. But demonstrating that clear connection, I think, is really important to keep in mind as we bring people along in this conversation to learn more about, PCEs.
Bree, do you have your hand up?
I do.
Okay.
Yeah. Thanks. One thing I just wanted to add to that, I just wanted to know, from the top, the top view, like, how does, this is a little bit different. Every year we throw you something new in these projects. Like the middle crisis mapping was another one of those. Like, oh wow, that's kind of a big ask, and then get to really produce some really great conversations that can inform leaders trying to figure out the same Maureen board and the OD2A funding out of the prevention division. They have with can't even remember what it stands for, but Maureen's been tasked to do ACE work in Montana, and Maureen's our partner in this work. And so from all of these local conversations that you all will have, we'll be able to take all of what you guys discuss and bring it into a plan that Maureen will then actually use. So this is directly going to feed the what's next for the state's ACE work. And so we mentioned that the state health improvement plan work group, the SHIP, the ACEs and resiliency group, that group has agreed to take like this work and think about ways to spread it all across the department that show up, OPI that shows up, a lot of different partners. And so just so you know, like, we're super intentionally trying to start with the grassroots conversations to then build into a statewide plan that you have informed. And then from that, hopefully we can generate, like, where are we at? Like, where do people want to work? And do we need to start over with ACE awareness? Did we lose that momentum, or is it still there? There's a lot of people that used to show up at my ACE trainings that would be like, okay, well, I have an ACE score of 8 and I'm fine. So that's why I'm kind of like really excited about the hope stuff, is because it's like, oh, okay, you're fine because you had a rad family. You guys went through some stuff, but like you had that connection to your family traditions that really helped. So for me, it's kind of, I'm just really curious. Like, I'll stop talking in a second so you guys can start talking about, could HMHB provide, do you need us to provide you specific training, or do you feel like you've got it? We've got some funding in the budget for travel and materials. Like, do you need help with things to get this done? Would you like us to try and calm? Just kind of something really from here to bring this training to your community. Like, how can we be helpful? That's pretty squishy on purpose.
Okay, well, I think we heard most of that. You were a little hard to hear at certain points, but hopefully people got most of that. Just that it's really like, this is a grassroots ground up and information gathering from your communities about what you need, and help us inform a statewide action plan that will be supported, and the SHIP work will take into account moving forward. That's my quick summary of what Bree said. So the things that I know Steph had said HMHB is planning to provide already are a potential training schedule and details, but like Bree said, Do you need that? Do you want to make it look like what you want to make it look like in your community, and someone else's can look different? I mean, I don't know. I think this is the discussion part. Any materials you think you'd want for meeting participants, and then an agenda for that conversation at a community level, and then just a documentation sheet that would come back to HMHB with the information that could then inform that state sort of action plan.
It seems where we talk. Go ahead, Shelley. Okay, yeah, so when we did the crisis mapping project, we actually had somebody who kind of developed the training outline for us. And I found that really helpful, especially since we're probably going to have a few people involved here in Bighorn County. And so if there was some kind of training outline like that, we would definitely want to be able to adapt it. But I just found that was her name Katie? Was that what her name? She did a training for us, and then she
Katie
had
Loveland.
everything.
Yeah, her name's Katie Loveland. She did mine too.
Yeah. So anyway, it was, you know, she did one for all of us where she had it all laid out, like even with the time, you know, how long it would take to do each section. But something like that, I just think it would be a great starting place for us. And then if somebody could come down and do the training with us, we would love that. I know Bighorn County is far, far away from most places in the state, but you know, Sarah, if you're missing Bighorn County and you'd want to come down and visit us, we would sure like that.
I definitely like to come see you. So I don't know. I mean, but I don't know. I think probably you guys have dates set, you know, for your meetings that are recurring. So I'm totally open to the idea of coming, but it would be once maybe Steph, you get those dates, you can share them with me, and then we can try.
Yeah,
to make
we'd be
that
willing to
happen.
work around your schedule if you wanted. If you're interested in coming down, we could schedule the meeting when you're available. So.
Okay.
But you know, no pressure, just inviting if you happen to want to come down here and.
No, I like to travel.
Or me.
I have a copy of Katie's agenda draft if you'd like me to send it to you. Just shoot your email in the chat and I'll send it over to you right now.
Thank you. Yeah, I'll put it in.
You bet.
Stephanie, I'm assuming that it's okay to collaborate with other entities and organizations as we have in the past with our deliverables. We have Maggie Anderson in Unite for Youth, she is on top of this. And so we are planning to do our event with her collaboratively to be able to kind of share the love. And I just want to make sure that that's going to be okay for our deliverable.
From my perspective, and I'll let Sarah chime in here, like that's encouraged. Connect with your people. Like if there are folks who are leading the charge in your community already, do not duplicate. Be investing in the work that's already happening and use it as an opportunity to strengthen those partnerships and that good work that's already happening.
Sweet. Yeah, for sure.
How about Sarah? Another question that I got via email early on was about length of presentations. Do you have any thoughts or recommendations on that?
I think it's more about like really understanding what communities want to do next than length. So it doesn't have to be a particular length. I mean, I guess I'm not sure how much your different coalitions know in terms of background and underlying information, or if you could just jump right into a conversation about, hey, you know, we've been talking about this already and here's what we're doing. And so I don't know, but I don't think it's supposed to be any like super lengthy process. What's your thoughts, Steph?
You're responsive to what your community has the capacity to do, / also where you are in the conversation. My guess is there's maybe a few groups who are on here right now who do have a pretty strong working understanding of ACEs at the coalition level, and that may be something, you know, that's there, but perhaps you're also using it as a time, as a way to connect with a new group in your community that maybe is not as ACEs or PACEs fluent, right? And so it might take a little bit more time to be able to do that, but that might be the first step, you know, in building out that awareness on a community level and engaging people. So, you know, we're relying on you all to kind of assess that readiness for different levels of conversation. Just to give a ballpark time, I think, you know, an hour for, you know, leading some kind of presentation, providing a little bit of information on positive childhood experiences and the HOPE report, and then kind of the necessary elements to really discuss or identify what are the what are the things we're already maybe doing in our community that are supporting these, that we can, you know, pull out and celebrate as, you know, building up positive childhood experiences, and how are those represented at your table or not, and then also thinking about, you know, like moving this up into the state level plan and that kind of conversation, but also the cool thing about some of the positive childhood experiences work is that it is actionable, right? Like taking a survey of somebody's adverse childhood experiences, so having them fill out that ACE form, you can't change those. You can try and prevent many of them, and some of them are preventable and some of them kind of aren't on different levels. But when we start to think about positive childhood experiences, we start to think about the ways that, you know, groups and individuals can really, you know, help to mitigate the impact of ACEs on kids, families, and adults in your communities. So always kind of leading with the idea of, like, you know, positive childhood experiences being actionable. We can do something about these, and that feels good. And I think I've heard that from members of this group too. Of like, I don't just have to educate about risk, I can organize to do something on a community level and move the needle. And, you know, that's really the start of these conversations. But to make a long answer short, you know, how much you'll have to invest, what will be in those presentations really is going to be based on each community's readiness. And we're happy to help you assess that. And talk through what an agenda might look like, and provide some TA on those pieces. But you all will know that better than us ultimately. Other questions?
Go ahead.
Other questions? June, you look inquisitive.
I have a question. I'm curious just if there are specific questions, and this just may be because I have not fully read the outline of our plan, but are there specific questions and data that you're wanting us to gather at these community meetings that we can, like, be prepared to implement during those conversations? Or yeah, I guess. Yeah, are there questions that we need to ask specifically?
Sarah, I'll toss to you.
I think that it was pretty generic in the scope of work that I was looking at. It was more like you need to provide a summary of your meeting that included the suggestions to increase awareness and promote, like PCEs being more widely available to children in Montana. So we will give you a community conversation form that you can document and put like a little, you know, section for the ways to promote or increase awareness of PCEs. And other than that, I think not more detailed than that.
Okay, thank you.
Yeah.
Anyone else? Well, you certainly all know how to find Steph, and I am happy to help with, you know, whatever. And I know Steph is too. And road tripping to Pam or anywhere else is not off the table. So, you know, I'd like to go see ECCs in the past, one of my last projects, I think I made it to almost all of them. So that was really fun. All right. I think then that's my time stuff.
I guess
Oh,
I have one more question.
I guess, is it just completely up to us, or do you have a preference on if this is something we just do as our early childhood coalition, or if we take it further into our community?
Whatever you want, I guess. I think there's no harm in taking it further into your community, but I don't want people to feel pressure to have to do that.
I just feel like kind of the same group that we got together to do the crisis mapping. You know, that was more focused on moms versus kids, but I feel like a lot of those same people, we talked about wanting to like continue those conversations and do other things. And so I kind of see that most of that same group being who we do for this. But that would be a lot of people that aren't on our actual coalition.
Definitely encouraged and allowed. Yeah, if you want a good reason to re-engage that group and call them back in, because they're ready to, that all of them are folks that, you know, anybody who was involved in the crisis mapping conversation would be a great fit for this conversation too, Jess. Good call. All right. Well, we are very ready to hear questions that come up later as you're starting to plan out this. Sarah and I will be in touch with some follow-up. One of the recording of this meeting to be able to, you know, share out with anybody on your team that couldn't make it if you would like to. Also the PowerPoint presentation that's got all those resources on it. And then the 2 different reports regarding hope measures in the state of Montana. And then some forms to support your community meeting. And we'll, go from there. Anything else, Sarah?
Nope, I think that's good, Steph. We'll be back in touch soon.
Hot diggity.
All right.
Thank you very much. I appreciate you so much, Sarah. And I know I was a little quick to not introduce you very thoroughly at the beginning of this presentation, but I just want to say to the group, there is no one more qualified to do this work. As far as like has been moving this conversation about how we improve early childhood experiences in the state. Sarah is it. So I'm very honored to have her in this space and to be able to work with. And so to that end, I'm encouraging all of you to ask Sarah questions, to really reach out and to, you know, get what information you can. We've got, you know, I don't want to say a beautiful genius here, but we have someone who has strong knowledge of early childhood in the state of Montana and how we make it better. And I'm just so thankful that you were able and willing to do this, Sarah. So thank you for that.
I am really excited to get to do it because I really love this topic. So thank you for letting me.
Yeah, awesome. Okay, I'm gonna stop the recording now. There you go. Great.